Ladies and gentlemen, esteemed colleagues, it is a true pleasure and a privilege for me to be hosting this exciting session today, looking at potential avenues of collaboration between the healthcare system in the UAE and in Israel. We will have wonderful laureates and colleagues, managers and physicians that will be speaking today about some of their experiences. And we will also do some comparisons between the healthcare system in the UAE and in Israel. And in order to kind of jumpstart that, I would like to start with a short set of slides that will take us through some of the unique modalities of the Israeli healthcare system and how it actually uses innovation in order to promote better care and better quality. I think that the most basic aspect of what allows us to be providing the care that we do is the structure of our healthcare system, in which all of our population is fully covered and that every patient has a full availability of primary care, specialty care, and hospital care that are generally free of charge. The medications are also being provided in a very, very small copayment that allow us to provide a relatively equitable provision of care to all. Another thing that helps us a lot is the fact that in Israel, we have had full digitization of our electronic medical records that has been ongoing for over 20 years. So within our capacity is the availability to use 20 years of electronic medical records that allow us to provide new types of care that are driven by the insights that are harnessed in this type of data. So one example to utilization of this unique resource of data in the clinical practice is what we called predictive proactive care. And we aim to provide care that looks at the entire population, identifies population at risk before they develop the disease or before they develop the complications, find them, call them, and try to do proactive preventive approach that will take them out of harm's way. To give just one example, we all know people, friends, family, patients that have chronic kidney disease, end-stage renal disease. Now, those people that require dialysis or renal transplantation have a lot of difficulties. They suffer considerably, and their lifespan is considerably shortened. And on this, we must add the burden on the entire healthcare system. Wouldn't it be great if we could reduce the number of new cases of end-stage renal disease? The way we try to do it is through proactive preventive care, and we use predictions for it. We use all the data in the health records that were taken 10 years ago in order to find the specific combination of the features, the complaints, the medical tests that were done, point us that this specific patient might have a disease in 5 years from now. So approach him now when he feels good, when he looks good, and we come and tell him, you know, you might feel well, but in 5 years, you are about to have a problem. So we approach him today and we change the medical practice and we are able to prevent completely this complication from happening in the far future. This is not theory. This is done in practice for hundreds of thousands and millions of patients every day at Klalit, which is the largest healthcare payer provider in Israel. So at Klalit, we care for over half of the Israeli population, for over 4.5 million patients, and we provide them all types of everyday care. At Klalit, we have over 1,500 clinics that care for these patients, and we have 14 hospitals, or 30% of the hospital beds in Israel, to provide this type of predictive, proactive care, some of which we will hear about in this session today. So the approach that we are trying to do is to use all this data to learn, to provide and to create innovation in digital health, to work with startups in order to embed some of the innovation that they bring in into our daily practice. And with all of this, we are trying to improve the quality of care and reduce future morbidity. And we have some very interesting publications and evidence to show that this is not only theory, it's practical, it can be done in scale, and it has real impact on patient care. So this approach that combines community care, hospital care, and digital health allows us to create what is called an integrated learning healthcare system. And this kind of integration is quite unique, and we are eager to share it with our friends and collaborators around the world, which we have many, and we will discuss this today. So with no further ado, let's begin with our panel. And so for this exciting session, we are very happy to have with us today Dr. Muppen, the chairman of Aster DM Healthcare, Saudi German Hospital in Dubai. Dr. Muppen, thank you very much for joining us. We have here at the studio Dr. Efrat Bronner-Lev, the director of the Schneider Children Medical Center of Israel. Thank you, Efrat, for joining us. And we have with us Dr. Eitan Wirtheim, the CEO of the Rabin Medical Center in Israel. Thank you, Eitan, as well. So I would like to start with you, Dr. Muppen, and to ask if you could please tell us a little bit about yourself. And while doing that, tell us a little bit about the healthcare system in the UAE and what are the main differences between the health systems of both countries.
Thank you very much. Thanks a lot. So I'm a physician, but last 15 years I have been into the healthcare business. I used to practice, I used to teach in the medical college. And then I'm from India. So I came to UAE about 33 years back and started as a small clinic, then started other clinics, hospitals, and now we have a fairly large establishment. We have about 24 hospitals in India and GCC together, mostly in UAE, as well as we have some 120 clinics in different parts of the world, mostly in GCC and India, and pharmacies also. So altogether, there are about 20,000 people with about 7,000 doctors. 3,000 doctors and 7,000 nurses. So that is basically what our company is, Aster DM Healthcare. And the difference between the two countries, I think it's very, very large in the area of technology as well as the healthcare, the development of healthcare. UAE has been having healthcare facilities, but not to the level of what is there in Israel, or for that matter, in many other countries, including India, when you look at it, because we all started this journey much earlier. So this is something which is required to be filled. There is a requirement for more of advanced care like tertiary care, quaternary care, as well as technology in healthcare to come in for this country to have the benefit of having the best that is possible anywhere in the world. That journey is happening, but it may take some more time. And it will be a great opportunity for Israel to help UAE in that journey to become, because Israel is considered to be one among the best when it comes to healthcare. And I see a lot of opportunities for that association between the governments as well as between the private institutions.
That is a really beautiful vision that you're laying here, Dr. Muppen. Thank you for that. I would like to come to you, Dr. Wirtheim. As you know, many world-leading hospitals have strong international collaborations. What can you tell us about the main interest and focus of your hospital in this context?
So, first of all, good day. And I would like to congratulate the organizers of this UAE-Israel conference. Well, as addressing the area of international cooperation, we have, I think, 5 areas where we have connections with other countries and other medical institutions. First of all is research, and then comes the clinical cooperation, fellowship programs, and collaboration between management, and last but not least, business sector cooperation. And I will mention several examples of each of our international cooperation areas. For several years, we have strong connection with UT Southwestern, which is a huge hospital in Dallas, Texas. It's a hospital that is investing each year more than $500 million just in research programs. And they have already 6 Nobel Prize laureates among their staff. So it's a great advantage that we have such a connection with this hospital. And we have 6 programs of mutual research that are ongoing for several years. For instance, in cancer, in cancer of the bladder, in cardiology, in gastroenterology, and so on and so forth. Another cooperation that we have just recently signed is between our cancer center, the Davidoff Center, and Princess Margaret Cancer Center in Canada. And again, we are starting with 2 new programs of research dealing with lung cancer. Another
Before you go on to the next one, I would like to ask you, Efrat, do you also have such similar collaborations going on with international entities in the area of research? We'll touch upon other areas in a second.
Yes, so I think that the Schneider Children's Medical Center, being the leading hospital in Israel for the past 30 years, really the only pediatric hospital in Israel, has many different collaborations with the largest centers in the world. Actually, because pediatric centers are very unique, there are two main associations, both in the US and the chief, Children's Hospital Federation, and in the European sector, the ECHO, which we are partners in. And so within those two organizations, we are in a partnership with Boston Children's Hospital in the US, with Cincinnati Children's Hospital in the US, and in the EU, I will mention just one, the GOSH, the London Hospital for Children. And in all these facilities, we are collaborating in different fields, especially in the field of cardiac surgery and cardiology as a whole, in the field of pediatric oncology and hemato-oncology, and in the field of endocrinology and diabetes in children.
So in a second, I will ask both of you to give me an example of research that you were proud of that was done in such a collaboration. But before that, Dr. Muppen, I'd like to come back to you. Do you hold such research collaborations with different entities in your hospital, between yourself and international entities that are, as a good example, could serve as an example here?
Yeah, we do some research, but international collaborations in the area of research is very limited, as I told you earlier, because the area of research and such advanced care, that is not the order of the day in places like UAE. But there are a lot of new things which are coming up, and we are looking at that both in the area of research as well as the digital area, the digital innovation in healthcare. So these are the two areas where we are looking forward for that association with, people like, from Israel or from the Western countries where this can be taken forward.
Wonderful. And I do think that such a collaboration can work very nicely with using some of the infrastructure and experience done here, both locally and with international collaborations, and having the most interesting research questions and subpopulations of joint interest studied here, and all of the inferences being then utilized in UAE in your own clinical facilities. Now, so this was the example of research, but when we think about utilizing modern technologies, it is also, I think, a key success factor in leading medical care. I would like perhaps to ask you, Dr. Wertheim, if you can share with us some ideas about how medical technology and innovation introduction into the hospital setting helps you in your daily care, and how this might serve as a platform for future collaborations.
Well, Rabin Medical Center is the merger of two hospitals, Beilinson Hospital and the smaller Hasharon Hospital. And for many years, Beilinson Hospital is a pioneer in Israel in the medical field. And we have developed many centers of excellence, many of them using the forefront technology that there is today. For instance, we are the leading hospital in Israel for the treatment of stroke. The largest number of patients in Israel receiving treatment for stroke with either tissue plasminogen activator injection or with a neuroradiological intervention to take out the blood clot that is hampering the blood flow to the brain arteries. It's done in Beilinson. So we are using the cutting-edge technologies for treatment of stroke. Neurosurgery, we have the largest neurosurgical department in Israel, and we've implemented every new technology that can help patients. During the last 2 years, we've implemented the deep brain stimulation pacemakers in order to treat the patient with a more severe Parkinson disease. Cardiology is another center of excellence in Beilinson. And for instance, for more than 10 or 12 years, we have implanted more than 1,000 TAVI aortic valve replacement, replacing the surgery with an artificial valve that is done via the arteries and not in open thoracic surgery. So we are leading in this type of cardiological interventions. In solid organ transplantations, we are leading the field in Israel. Over 2/3 of the solid organ transplantation done in Israel are done in our institute. We are the leaders in lung transplants. More than 800 patients have received lungs that were donated by people who were dead, and their families donated their organs. We are leading in the field of kidney transplant, liver transplant, and also using, again, the forefront technologies. Da Vinci robot is used for those patients who need a kidney from a living donor, and the harvesting of the kidney as well of the transplant itself is done with the use of the Da Vinci robot.
So, Dr. Muppen, as you hear some of these technology being used there, and I'm sure many of these are also used in your hospital as well, do you see an avenue for collaboration in joint learnings between what you have been doing there, the experience, the clinical experience that you have acquired there, and the vast experience in those specific domains? We'll talk about children's medicine in a second. But do you see any avenue for collaboration in joint learnings, in sharing manpower and know-how between the two institutions?
Definitely. There is no doubt about that. And so like what has been just told, the solid organ transplant is one area where UAE is slowly picking up. So, see, we have hospitals in India which conduct a lot of solid organ transplants, and we use Da Vinci and all for kidney harvesting. But when it comes to UAE, the number of cases being done as well as the expertise available will be limited. So I see significant opportunity for the doctors from Israel to come here and operate, and that will be a significant opportunity, as well as to train the people here in some of these techniques which are not being routinely done, and also have that exchange of people between the two countries where the people can learn, because you have large number of cases. I was so surprised hearing from doctor about the lung transplant, which is a rarity. Even in India, we don't do too much of lung transplants. We routinely do liver transplant and kidney transplants and all. Recently, we finished 200 kidney transplants with the Da Vinci. So those numbers are there. But when it comes to lung transplant and all, very limited numbers, even in India. But here in UAE, it will be counted in fingers and done in very few hospitals, occasionally by visiting doctors. So there is a requirement. This country is not the just 10 million people here. This is the place where people from all over the Middle East come because of the connectivity, the very good infrastructure. Okay. Yeah. So nearly 1 billion population in the MENA region, they come to Dubai as well as to Abu Dhabi. So we have that opportunity to get patients here on medical tourism who will be looking forward to such procedures.
So, Dr. Harlev, do you think that such a collaboration is also relevant for basically for pediatrics, and what kind of activities that are now performed in your hospital, which is, I think the most prominent pediatric center in Israel? Can you give a few examples of areas in your domain where you think such amazing suggested scene of collaboration could take place?
There is something very special about a pediatric hospital. It's not just another hospital. A pediatric hospital, like the Schneider Children's Medical Center, is a place where children come with their parents and need very different care. So we're not only looking at medicine and tertiary care medicine, as we are doing all the organ transplants for children in Israel, most of the oncology care in Israel for the pediatric world, but also we look at health and preventive medicine. So, for example, our genetics is very high-tech and looking very well into different genetic problems throughout families with such problems and even families without. So we know that today, when talking about personal medicine for adults, it must be the right way for the pediatric world as well. I think that our hospital is looking at the patient not as a patient, but as a child. So we do child care, and everyone in our hospital speaks pediatrics, from the head of a department, of course, the head of the hospital, which I'm a pediatrician myself, until the very simple task workers. They all speak pediatrics. And this is also what we teach when people come to our hospital in different areas of taking care of the pediatric patient.
And are you looking forward for collaboration with our friends here at the UAE, as was suggested? Is it something that you would be willing to entertain?
We're not only willing, we really believe, because our hospital was meant to be a bridge for peace. And since now we have this peace and we are very happy about it, we believe that the children are above and beyond any politics, any war. So this is really a situation to use these peaceful times in order to do much collaborations between our two people in all the different fields of pediatrics for the children of the United Emirates and for the people of the United Emirates. I think that we can build partnerships and do things together in the pediatric world.
I think that was beautiful and moving. And I would turn back to Dr. Muppen and ask, are there any specific domains that you see of unique interest for you to collaborate in terms of the clinical side or within the technological side? Things like artificial intelligence and advanced technology and many other aspects that we will soon hear from our colleagues here, what is done here. Are there any specific domains that you find that would be most appropriate to begin with as we begin this collaborative effort?
Yeah. So when we look at the opportunities for collaboration, one definitely is the skills for which there will have to be, like what I said earlier, exchange of people and the people coming from Israel, the physicians, surgeons, and providing that there is a significant opportunity in all the areas, especially in the tertiary to quaternary care. And especially in areas like pediatrics, because pediatrics, there are some hospitals which are pediatric specialized hospitals, but not to the level what has been spoken here. So I think there is a significant opportunity for people on both sides in the tertiary quaternary areas coming, people from here coming there and getting trained, as well as people from Israel coming and doing the procedures here. From the technology side, like what you said, there is again significant opportunity in areas like digital health. Digital health is catching up, and that is one area slowly picking up, starting from a simple telemedicine consultation onto areas like tele-ICU. And again, the requirement of intensivist and all in the tele-ICU and in the ICU is a big issue here. So getting this connected with appropriate institutions away from this country and getting that through technology will be something which can be looked at. Then there are a lot of other areas where the, areas like research, what has been mentioned earlier, that is one area where it's in the primitive stage, I should say, that this has to take up, and those things can be definitely looked at. Another very important area which I feel is that in the cooperation in the medical education. Medical education in this country is there, but I think there is a significant opportunity for the faculty exchange and the teaching of many of the clinical specialties, as well as even the basic sciences. There is a opportunity for cooperation with Israel. So I have been speaking to some of the hospital heads in Israel before this, and when we look at the levels at which these are being done are entirely at a different level when we look at what is being done. For example, in area of rehab, I had a discussion recently with one of the Israeli hospitals, and the level at which they are operating with exoskeleton and areas like that is something which can be definitely be utilized for the benefit of this country.
Wonderful. So, which I think is a great segue to ask Dr. Wertheim here. As you know, in Klalit, the area of digital health is something that we very much focus and pride on. Could you share some light on some of the activities done in your hospital in the fields of digital health and how that could be used in order to foster additional collaborations with the UAE?
So, first of all, thank you for the question. And here it's the time to say that Beilinson Hospital, as well as, of course, Schneider and other, altogether 14 hospitals, we are part of Klalit Health Services. And Klalit is one of the two larger HMOs in the world, Kaiser Permanente in the United States and Klalit Health Services in Israel. And we have a vast data set of knowledge gained over the last, I think, 30 years from our electronic medical records in the community clinics and in the hospitals. And this big data is, of course, the basic infrastructure for developing artificial intelligence algorithms that will help us treat patients much better. So in digital health, I can say that we are invested and we are dealing with every part of what's called digital health. Just to maybe give an example of using this huge data set of knowledge that we have, and I'm not just referring for the electronic medical records, but for instance, for the radiological information system. And in our RIS system, we have data from hundreds of thousands, for instance, of CT scans. And we have a strategical cooperation with the companies that are developing artificial intelligence applications, for instance, Zebra Medical. And we've implemented their system in our radiology department so that each CT scan that is done is also being reviewed by their system in order to facilitate diagnosis and help patients get their treatment earlier and more accurate, what we already start to say precision medicine. So this is one example of digital health. The other example, I think, that's very important is our connection between what we are doing in the hospital and the patient at home. This is, I think, the next area where we want to proceed and do a lot of work because the technology is here. We can do it. And our departments already give consultation between physician to physician in the community, and nowadays also between physician in the hospital and the patients at home. And the time of COVID-19 era has facilitated this connection, which is digital health, with our patients to a new level. Because if it was done for few patients 1 year ago, nowadays thousands and thousands of outpatient clinics are being done in that way.
I think these are really beautiful examples, and the collaboration with the local startup industry is very important. We are making huge efforts to make such connections between all of our hospitals and the amazing ecosystem locally of hundreds, some say almost 1,500 local healthcare and medical startups. And we are trying to build the bonds between the healthcare institutions and those startups to serve as a testing bed as well as a more of a scaling opportunity for these. And I think that the example of Zebra Medical Vision, that the joint research that was published in Nature Medicine just this year on how we can implement these CT-based artificial intelligence inferences in order to identify early patients, both in the hospital and in the community with risk of fracture. I think this is an excellent example of such a collaboration. As our time is getting short, I would like to appoint one last question to each and every one of you, and it will be the same question to all. And I will start with you, Efrat. If you can give me some kind of a personal thoughts. I mean, this is also exciting for us, this new era of peace and collaboration, and the opportunity to start a new set of collaborations with new friends, I think is something that is really exciting to all of us. Can you give us a few of your own personal words of how do you see this moving forward, and what are your biggest aspirations as you look forward to this collaboration?
again, talking about the child, we're talking about children. And my biggest aspiration when talking about our connection with the UAE is to find a way to put the child in the center, to use all the professional skills that we have here with the professional and passion of skills that there are at the Emirates, and to use them in order to give better health for the child, whether using digital, whether using telemedicine, or whether really touching and feeling the patient, the family, and of course, the people that are taking care. I see it as a partnership and not just as a business plan, but really as a partnership together with whoever would like to have this partnership.
Beautiful. So the emphasis on partnership, well taken. Moving to you, Dr. Wertheim, some personal notes for conclusion?
So first of all, Dr. Muppen, I will be more than interested, and it's really interesting to come and see your healthcare system in the United Arab Emirates. I always go abroad to see new things, learn from other people from other countries. It's always enlightening and brings me new ideas. And then, of course, we would like to have collaboration in the three main fields that is our mission as physicians and leaders in the healthcare system. First of all, is to treat our patients, give them the best treatment. So it would be great to know how both countries, both healthcare systems can help each other for the benefit of our people in Israel, the people in the United Arab Emirates, in every field, in community healthcare systems and in the tertiary hospitals healthcare system. And then, of course, to do research, because we are in charge of producing the new frontiers, the new knowledge in medicine, and I'm sure that collaborating in research can do that. And of course, fellowship programs, really physicians, nurses, and other staff members to come to each other hospitals and learn what we are doing and to do it better and better. So it's really something to look forward.
And of course, we invite you to come here. We really want to see you here. We will be happy to have you here.
So that was beautiful. And the personal exchange, I think, is something that we'll take onwards. So the final words is for you, Dr. Muppen, to summarize and to tell us what your take-home message is, what excites you most, and what can we be looking into in the future?
Yeah. Thank you very much. Thanks a lot. That has been very kind of all of you to offer your support as well as to know UAE as well as the healthcare system here. Definitely, we will be very happy to travel to Israel as well as welcome you here whenever you wish. We will definitely look forward to that. Now, looking at the opportunities, I think that there is definitely a gap in the clinical knowledge as well as the expertise, as well as in other areas where Israel can definitely be of great help for this country. And there will be also knowledge which can be exchanged. There will be certain areas where we could also provide some support or some, sort of information which will be of help. So I see huge potential, one in clinical practice development, where in niche areas, especially in the tertiary and quaternary care. And then in digital health, there is another huge opportunity for us to move forward because 150 startup, 1,500 startup healthcare innovations there. And there will be definitely a lot of things which can be tested here as well as tried and adopted here. That is another huge opportunity. Then we could provide this as a platform where people from other countries can come and they can experience as well as utilize the better healthcare that this area can provide. Because the greatest advantage when you look at Europe or US is that the travel time is much less when compared to those places, as well as the culture and language opportunities are there when you are looking at somebody from Israel coming here and helping us, or we coming to Israel. So I think there is significant, synergy between this relationship, which the great leaders have envisioned and they have started this journey. As part of that overall wheel, we in healthcare being a major area, I think we have a major role to play in this. So just to summarizing, I think the exchange of ideas as well as information and the knowledge that is gained through that, as well as the opportunity to serve people beyond even UAE by this association is what I foresee.
So I think with those beautiful words and the thoughts about health and health collaboration being the bridge for partnership, for friendship, for collaboration between the nations, I think that is the best way in order for us to conclude this very exciting session. I would like to thank you, Dr. Muppen, for participating here. And I'd like to thank my colleagues, Dr. Veta and Dr. Baron Arlev. Thank you so much. And for the audience, we wish you a very interesting continuation of this conference. Thank you.